Hello, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and founder of the website betterhealthwhileaging.net. And this is the Helping Older Parents video podcast, where I cover the best ways to support aging parents and other older loved ones so they can live better lives in their later years. I also often address common caregiving concerns and dilemmas, like what to do if you're worried about an older person's memory or safety, how to deal with Alzheimer's and other forms of dementia, and how to help your older loved one get the care they need. In this episode, I'm going to address something that people often ask me about, which is, what are the most common warning signs of early Alzheimer's disease? Now, the Alzheimer's Association has maintained a list of 10 early signs and symptoms for quite some time. And honestly, it's really good. If you haven't looked at it yet, I would highly recommend it, and I'll post a link to it in the notes for this episode. But when I thought about my own list of warning signs, based on my years of experience seeing patients and coaching families, it wasn't quite the same. Honestly, it's because early Alzheimer's can easily affect the brain in more than 10 ways. So let me take you through 10 warning signs that often catch my attention as a geriatrician. Now, bear in mind that these are warning signs. They don't mean that your parent or older loved one definitely has Alzheimer's. They're mostly a warning that something is going on with the brain. To get an actual diagnosis, it's always necessary to get an evaluation by a qualified health provider. That said, if you notice these signs, especially if it happens regularly or often, chances are that there is something going on with your parent's brain function, and so ideally, your older parent would get evaluated and helped. So let me now take you through my 10 warning signs of Alzheimer's. Number 1 is poor short-term memory. Now, people often think this is normal with aging, but actually it's not. And it's especially worrisome if they keep forgetting what happened recently or if they keep asking repeated questions because they can't remember what they were recently told. Now, you should know that it's extremely common for short-term memory to be affected, but for long-term memory to be preserved for much longer. So for instance, we often see that older adults with early Alzheimer's are still able to remember their childhood or information they've known for a long time, but they often have trouble remembering new things. Next on my list is repeating the same stories or questions. In particular, repeating the same stories over and over again is a total warning sign for me. Now, let me tell you a true story. Many years ago, I was doing a few weeks of attending on the internal medicine service in the hospital. That's when you're the senior doctor supervising junior doctors. And we had an older gentleman in his early 90s who had been hospitalized for heart failure before I came on the service. And when the residents told me about him, they said he was so delightful and how it was so funny that whenever they'd see him, he'd repeat the same story about how he was looking forward to going home to eat some beans and greens. Now, when I heard this, I said, and does he seem to be cognitively okay? And they assured me that he was fine. He just liked to talk about beans and greens. But when we went to see him together, I asked him a few more questions about things that had happened recently and his medication, and it turned out he couldn't remember any of those things. And it did turn out eventually that he had early dementia. And actually, the internal medicine residents had missed it because they were focused on his heart and also because he was being very friendly and charming in conversation. Now, why might a person be repeating the same story when they have early Alzheimer's? I think it's often about a few things. One is that they may not remember that they just told you the same story recently. Another thing that I think drives this for some people is that even though they are having trouble with memory or thinking, they still feel a drive to be socially respectable. And so they want to make the listener happy by making conversation. Or, I think in other cases, people are trying to cover up their memory problems because they realize at some level that if they keep saying something, they might be asked fewer questions. Okay, let's move on to warning sign number 3, which is difficulty with instrumental activities of daily living, IEDLs, that they used to do easily. So, as I explained in a recent episode, IEDLs are the life skills that we often learn as teenagers. They include things like managing finances, grocery shopping, cooking, home maintenance. And in early Alzheimer's, we often see people struggle to do things they used to do pretty easily, especially those activities that require a few steps, like planning and cooking a meal, making reservations for a vacation, getting the bills paid on time, getting the yard cleaned up, and so forth. And the person often has trouble explaining why they couldn't do it, or they'll just deny that they had any trouble with it at all. This phenomenon is generally related to people developing difficulty with executive function and problem solving, and it's common to have trouble with these skills in early Alzheimer's. Number 4 on my list is unaware of or denying difficulties or mistakes. Not only do many people with early Alzheimer's have difficulty doing things they used to do, but it's really common for them to either deny they had trouble or otherwise seem unaware of it. In geriatrics, we often refer to this as lack of insight. There's also a fancy medical term for this called Anosognosia, which is related to the Greek for without knowledge of disease. Anosognosia means being unaware of a neurological problem or psychiatric condition, and it's associated with mental illness, dementia, and certain forms of stroke damage. It is very common in early Alzheimer's, so I consider it a warning sign. Now, it can sometimes be hard to tell if a person is truly unaware of their problems versus denying them because they're embarrassed or worried that their independence is going to be taken away. But in general, we know that Alzheimer's often affects insight, and people often have trouble remembering or perceiving difficulties they are experiencing. So if this is happening to your parent or to someone you care about, it's very frustrating if they keep denying things, but you need to remember that they aren't necessarily being stubborn or purposefully trying to deceive you. It's probably lack of insight due to their brain changes. Now for number 5. Number 5 on my list is accusing others of taking things, stealing things, hiding things, or misplacing things. So for instance, the older person might start accusing others of having taken their wallet or purse, or their glasses. This is another one that's a warning sign for me, and it sometimes comes up before the person is otherwise showing signs of memory loss that are obvious to the family. Why might this be happening? In many cases, it's the older person who has misplaced their belongings due to memory problems or confusion, but they either can't remember that or can't really accept that, so they conclude that someone else has taken the item. Next on my list is developing delusions, also known as false beliefs. This is a little less common than the other signs I've mentioned so far, but occasionally I encounter someone in which one of the earliest symptoms is that they start to report something really bizarre to their family or doctors. It's often something that seems far-fetched or impossible to most of us, but they can become quite convinced that this is true. So when people believe something that most people around them agree is not true, we call this a delusion. Some of the early delusions I've encountered or heard about from families include that people are entering the house, especially at night, that their medications are being replaced by poison, that their spouse is having an affair, that people are out to get them or harm them, that a deceased person has come to visit. Delusions often have a paranoid flavor, meaning they involve suspicion and fear of harm from others, but that's not always the case. Now, it's common for people with Alzheimer's to have delusions once they've developed other obvious symptoms of the disease. But every now and then, I hear about someone who hasn't yet been diagnosed with Alzheimer's, but who's telling a story that sounds bizarre and is likely to be delusional. So when that happens, I pay attention, because I know that delusions can be a warning sign of Alzheimer's. That said, there are other conditions that can cause delusions, so of course, the next step should be further evaluation. Moving on to number 7. Number 7 on my list is developing hallucinations. A hallucination is when a person perceives something that others don't. So a visual hallucination means seeing something that others don't, and an auditory hallucination means hearing something that others don't. Hallucinations are sometimes an early warning sign of Alzheimer's or another dementia. Visual hallucinations are actually associated with Lewy body disease, which is another common cause of dementia in older adults. In Lewy body disease, it's fairly common for the person to report seeing children or animals. Next warning sign, number 8, is getting lost while driving or walking. Getting lost in familiar surroundings is another concerning symptom that sometimes pops up early. It can be related to memory problems, but it can also be related to difficulties with spatial memory or with recognizing familiar landmarks. Moving on to number 9. Number 9 on my list of warning signs is trouble with speech and language, especially with naming things and finding words. And that's because Alzheimer's does often affect the part of the brain that manages language early on. So one early warning sign is to start having trouble naming things or finding the right word for things. Now, anyone can have trouble remembering a word every now and then. We've all had those "what is it called again" moments, and they do generally become more common as we age. But if people can't name an object that's shown to them, or if they use a descriptor instead of the name of the object, such as the thing you sit on, instead of saying chair, that would be concerning. It would also be concerning if they start to use words that aren't quite right, such as book to refer to a newspaper. Now, Trouble producing or understanding language is called aphasia. But aphasia, by the way, is not a diagnosis. It's really a symptom that's caused by some kind of underlying problem affecting the parts of the brain that manage language. So when they announced that actor Bruce Willis had aphasia in March of 2022, I thought, due to what? And what other symptoms is he having? And actually, it turned out that coworkers had been noticing cognitive difficulties for a few years. Ultimately, Bruce Willis's family announced that in 2023, he had been diagnosed with frontotemporal dementia, which is another type of dementia that can affect older adults. Moving on to warning signs number 10. That's uncharacteristic behaviors or changes in personality. This is when things happen that leave others who know the person saying, "That's so weird. This is so unlike them." Sometimes it's uncharacteristic spending or risk-taking, or it's actions that reflect impaired judgment. Other times, it's a change in social appropriateness or in how the person engages socially. So it might be someone starting to blurt out inappropriate things. Or it could be that someone who used to be very social becoming withdrawn and much quieter. And so there you have it, 10 warning signs that often cause me to sit up and pay attention and wonder if someone might be manifesting early Alzheimer's disease. Now, there are, of course, many other signs and symptoms people can have early on. I actually have a list of 21 in my book, and I cover those in another video. So if you'd like to learn more about what to look out for, be sure to check out that video. I also want to point out that although I've been referring mostly to Alzheimer's in this video, it would also be reasonable to say that these are common early warning signs of dementia in general, because most dementia in older adults is caused at least in part by Alzheimer's disease. If you'd like to learn more about the difference between the terms Alzheimer's disease, dementia, and also mild cognitive impairment, be sure to check out one of my other episodes in which I cover that topic. Otherwise, if you've noticed one or more of these signs in your aging parent, or in someone you care about, I don't want you to panic, but I do want you to pay attention and keep thinking about how you can support your older loved one in getting more of the help and care they need. One important next step, if you've noticed worrisome signs, is to help your parent get an adequate medical evaluation so that your parent and your family can find out what is causing the memory loss or other symptoms. But that, of course, can be tricky because often older adults with warning signs of early Alzheimer's disease are lacking insight. That was warning sign number 4 on my list, and so they can't see that they're having a problem that requires evaluation. Or they may not want to go to the doctor or tell you what the doctor's been doing about it for their own reasons. If you're in this situation, then I do have a free online workshop to help you with this, and I'll post a link below. Or you can stay tuned to my channel, because in upcoming episodes, I'll be covering some of the ways to take those next steps and how to get around common challenges in getting a person evaluated for possible Alzheimer's disease. So, with that, thank you so much for watching. Take care. If you enjoyed this episode, please do subscribe. It does help other people find the channel. And otherwise, I hope to see you again very soon on another episode of the Helping Older Parents video podcast.